In this video, I will show you how lateral pelvic tilt is causing SI joint pain. Did you know that you simply cannot fix that condition if you will not address the position of your pelvis first? I will use my online client as a successful example to show you how to address that dysfunction, and also I will show you one very important exercise that you need to do to fix your SI joint pain. Are you ready? Let's go.
Although there are less obvious causes of SI joint pain, include autoimmune processes with chronic inflammation, or lumbar spine arthritis that mimics SI joint pain. However, I work only with patients that have biomechanic aspect of pain. Take a look.
And here you have this SI joint connection here, and both of them are joining your column of your spine with your hips. And this joint actually allows you to move back and forth to shift your body mass from leg to leg, from left to right.
The SI joint connects the sacrum and pelvis together. So when the pelvis or sacrum lose their normal position, it becomes the foundation of pain. Usually it happens after some sort of injury. Pelvis is getting freeze in asymmetrical pattern to the right side, also known as left AIC, or at times double AIC patterns. Normally when we walk, both pelvises should move back and forth. Sacrum should rotate it left and right. But when pelvis is getting stuck, the alternation of load stops. Just like my patient, when he tried to switch from his right leg to his left, the alternation of pelvic positions never occurred. He got stuck, and because of that, he was in pain. Some specialists refer to this as lateral pelvic tilt. However, I believe that the term lateral pelvis tilt is outdated. So let me tell you about my patient. His name is Alex, and he's from Kharkiv, Ukraine. Before working with me, he was going from physician to physician, but without any success. He met me via online, and we started to work. Initially, his walking process was far from ideal. After a knee injury, his pelvis became stuck in an asymmetrical pattern towards the right side. That caused a significant pain in right SI joint. So I was progressively giving him a bunch of postural restoration exercises to relax his body and to de-rotate the pelvis. After 2 months, he finally became pain-free.
I had pain in right SI joint and right sit bone. Also, I noticed that my posture was twisted in a way. So I realized that my twisted walking and pain were related together. In addition, I felt the overload of my right leg, so that's why my right knee was painful. Lastly, my right hip was clicking and snapping. It was not painful, but anyone around me could hear that. After 1 month of PRI, I noticed a positive sign. I was able to take a long walk without experiencing any pain in my right knee. Secondly, after 2 months, the right SI joint pain completely vanished. There are no more hip clicks and snaps. Additionally, my body feels more relaxed overall and my neck is less tense.
Right now, I will show you exercise without which Alex could not progress in therapy. Regardless of which side is painful, the main goal is to rotate the pelvis back to the left side. This naturally occurs only when the right limb swings forward during the normal walking process. Therefore, we need to engage right hip flexors, sartorius, and iliacus muscles to overcorrect that pattern of walking. Lie on your back. Keep your hips and knees at a 90-degree angle. Place both feet on the wall. Lift your pelvis up off the floor. Still keep your lumbar spine connected to the ground. Then lift off your right foot off the wall. You will feel the load on your left hamstrings, making sure that your right knee is positioned higher than the left one. Push your right hip towards the ceiling. Rotate right leg outside while right foot is rotating inside. You should feel the muscles in your right groin. Also, don't forget that the left knee should always remain pressed to the right side, to the middle line. Hold that position for 5 breaths. Relax for 1 minute, then repeat once again. If you find it difficult to feel the right groin muscles, simply try moving your right hip slightly higher. You must step out of your comfort zone and extend your range of motion. The idea is to gently twist your sacrum bone and move it towards the left orientation. Imagine that your sacrum and both legs are like balls. To roll the middle sacrum to the left side, you got to twist both balls to the right side. That's why leg work is crucial for success. Also, remember that treatment should be individualized. There is no such thing as one exercise that can fix everyone. Message me, and we will establish your personal plan of treatment, online or in Polish office. See you soon. Stay symmetrical.